Hi everyone, welcome back to my YouTube channel. Today we are going to talk about anatomy of the face. In the previous video, we identified all the bones of the skull. Now let's move forward and focus on the face. In this video, I will explain the layers of the face, the muscles, nerve supply, blood supply, and the lymphatic drainage. All the important points you need for exam. Let's start with the layers of the face. From superficial to deep, they are skin, subcutaneous tissue, muscles of facial expression along with the superficial musculoaponeurotic system, deep fat layer, periosteum, and beneath that the facial bones. Now let's move on to the muscles of the face. There are two types of muscles, muscles of facial expression and muscles of mastication. All muscles of facial expression are supplied by the facial nerve, which is cranial nerve 7. Most of these muscles originate from the bone and insert to the skin. This is the key feature that allows us to produce facial expressions. The main muscles of facial expression include occipitofrontalis, orbicularis oculi, orbicularis oris, buccinator, and the platysma. Now, muscles of the mastication. All the muscles of mastication are supplied by the mandibular division of the cranial nerve, which is cranial nerve 5. These muscles are responsible for movements of the jaw. They include temporalis, masseter, medial pterygoid, and the lateral pterygoid. As mentioned earlier, the muscles of facial expressions are supplied by the facial nerve, while the muscles of mastication are supplied by the mandibular nerve. Now let's talk about the sensory innervation of the face. Most of sensory supply to the face is provided by the trigeminal nerve, which is 5th cranial nerve. However, there is an important exception, the angle of the mandible, which is supplied by the greater auricular nerve. The trigeminal nerve have 3 main divisions, each supplying a special region of the face. The ophthalmic nerve supplies the upper part of the face. Maxillary nerve supplies the middle part of the face. Mandibular nerve supplies the lower part of the face. In this image, we can clearly see the areas supplied by these 3 divisions. The main artery of the face is the facial artery. It arises from the external carotid artery, pass deep to the mandible, then curve around the lower border of the mandible near the submandibular gland and ascend over the face. Along its course, it gives several branches and finally end as the angular artery. Next, the venous drainage. The main vein of the face is facial vein. It joins with other veins to form common facial vein, which then drain into the internal jugular vein. Finally, lymphatic drainage. Most of lymph from the face and the head region ultimately drain to the deep cervical lymph nodes. So in this video, we covered the muscles, nerve supply, blood supply, lymphatic drainage of the face. All the key anatomical points you need for the exam. That's it for today. That's it for today. Thank you so much for watching and I will see you in the next video.